And welcome into Getting Help from Uncle Sam, or when we do something that pertains to the state of Alabama, it's Getting Help from Aunt Alabama. You know, if you've watched this show and you're a senior citizen, you may remember the times in the state of Alabama where when a person has some kind of a mental problem, there were lots of facilities around the state to take care of them. Over the past few years, we've seen them disappear little by little. Today, we're very fortunate to have with us Jim Perdue. Jim, you are the Commissioner of the Alabama Department of Mental Health.
That's right, Jack. Good to be here.
Glad to have you here. And let our viewers know, basically, your department has, they've got a lot on their plate.
We do. The Department of Mental Health is a lot more far-reaching than I ever imagined. I began my political career in Crenshaw County, right. Luverne's county seat. I was a probate judge there for several years, about 14 years, 13 and a half. And so part of our responsibilities were civil commitments. Those individuals who were a danger to themselves or danger to others, and they needed immediate attention. I served on the local mental health board. I served as a president of a child and adolescent psychiatric hospital. But Jack, when I got in this office, I realized the reach is unbelievable. Yes. We serve all 67 counties, either directly or indirectly. Now, we have reduced facilities. In the past, when you and I were growing up, there were facilities, institutions,
full-blown hospitals
everywhere.
Yes.
Old Bryce Hospital in Tuscaloosa had as many as 5,000 patient rooms. Had served as many at one time as 7,000 people. It was overcrowded. We also had facilities similar to that here in Montgomery called Grill Hospital, in Mobile County at Mount Vernon, Searcy Hospital, and in Decatur, up in Morgan County, North Alabama Regional Hospital. So we had institutional care that covered from one end of the state to the other. Not to mention the fact that there were local hospitals that would triage, if you will, before we transported them to one of those institutions.
And they would even have a unit on that in the hospital.
Absolutely. Now, times changed.
Yes.
In the early days, and even before you and I were born, people may go to somewhere like Bryce Hospital or Searcy and stay. It was an institution where people were sent for the rest of their lives. When Bryce Hospital was built in 1861 in Tuscaloosa, far away from the campus, which now, if you've been to Tuscaloosa, the campus surrounds Bryce Hospital. It was the largest building in the state of Alabama.
Wow.
Now, you think about that. In 1861, what was the largest building in the state of Alabama, and what was its purpose? Well, that defines mental health. But now it's changed, and the reason it's changed is because it needed to change. You know, long-term institutional care for individuals that could be at home or be in their communities was not the right way to do it. Otherwise, you just keep building hospitals.
Sure.
And so, but also drugs have changed. Psychotropic drugs are available now that can help change the way people think and act, and they become titrated on the drug to the point that they're not as dangerous, as long as they stay on the drugs.
Absolutely.
But you know, you and I know,
that's the operative word.
You know, we don't take our blood pressure and our diabetes medicine because we don't need it. Well,
Absolutely.
That's what we say. Now, a doctor might tell us we need it, and that's the same thing with individuals who might need a psychotropic drugs. They think they feel so good, I don't need it anymore. And that's part of the problem that causes people to decompensate, if you will. So times have changed. It's changed for the better. But now we've still got a lot to do.
So, like you say, in all 67 counties, you have a presence. So if some of our viewers have somebody in their family that they feel needs to have some help, they can be addressed at in one of these counties.
Well, either by their community mental health center,
right, or
the probate judge's office.
Usually they're physician, if they have a physician, will recommend it.
That's the first place to start, at the physician, at their health department, at the courthouse. If you have someone that you care about that's struggling, and the signs may be they're depressed, they could be crying uncontrollably, or hearing voices, or
easily agitated.
Yes. All those things. Then you could go to your probate office and say, I need some help, what can I do? And I was a probate judge.
Right.
I always said, that's the emergency room entrance to the courthouse.
Absolutely.
You know,
absolutely.
Our friend Reese McKinney was here in Montgomery.
He did in Montgomery County.
A very accessible office, and a very kind office. Stephen Reed there is there now, good friend, a very good judge, and very involved in the community, and that's what probate judges do.
And I think our viewers need to know that in all 67 counties, there's going to be a probate judge.
Absolutely.
In each county. And those probate judges, one of their many duties is not just to get your driver's license renewed and your tag renewed, but as you say, it's to take care of the competency of persons.
And that is the court of original jurisdiction for mental commitments. And so it's there, it's your hospital, it's your doctor, you know, or your community mental health center.
Well, Jim, we thank you. We thank you for the excellent work you're doing with that department down there. I know that the challenges are many and the resources are few, as everything else in state government. But from our viewers' perspective, if they need any information, can they contact your office also?
Sure. You can go to our website, Alabama Department of Mental Health.
Good.
And that's a good, we'll have all the contact information there.
Great, thank you so much. And just remember, mental health is something that can affect more people than we really realize, but help is available. We'll be right back right after this.